So today we will discuss ethics. Ethics is the standards or the accepted standards of what is right and what is wrong that guide us in our personal, professional and social life. The so-called bioethics means we are dealing with human beings or maybe animals for treatment and research. So this is slightly different from law. Law is something beyond which you should not go. But ethics is within the law. You can do what is right and what is wrong as per the societal or the personal or the professional norms. There are 4 pillars of ethics. One is autonomy, second is beneficence, third is non-maleficence, and the fourth is justice. Autonomy means the patient has got the freedom to make a decision what to do with his disease condition. Beneficence means in Malayalam it is upagara. Beneficence means what is beneficial for the patient that we will do. Third pillar is non-maleficence, which means we are not doing anything that is harmful to the patient. For example, mother is pregnant with a big baby, it is unlikely to come out through normal delivery, so you do the cesarean. That is beneficence, because that is for the benefit of the patient, because if it is not done, something bad may happen to the baby or the mother or both. Now coming to the non-maleficence, the same example, you are going to do a cesarean, but this time actually the patient can have a normal delivery, but that delivery is likely at midnight and you do not want to come at midnight. So you will do cesarean daytime and go and sleep comfortably. So that is something that you should not do, non-maleficence. Because in this given situation, the mother would have delivered normally without a scar, without antibiotics and so on. Now justice is actions in tune with the law and rights of patients. There are more than two, but essentially 2 ways of looking at it. One is equality. You give equal opportunity or equal resources to all. For example, whatever be the gender, whatever be the religion, whatever be the financial status, you treat them equally. There is a slightly different term called equity. In equality, actually, you start with giving the equal opportunity or equal resources to all. But in equity, you are aiming at same outcome for all. For example, from ration shop, poor people will be given, say, 30 kilogram of cereal, and the rich may get 2 kilograms or so. Ultimately, all of them will sleep without hunger. So the end result is now the same. This equity applies to our basic requirements. For example, toilet that is being constructed for all. So that is a basic need, toilet. So all of them will be given. But then those who have money can make their own toilet. Those who are poor, the government will construct toilet. So that is another example. But this equity, routing resources as per need, that is applicable only to our basic needs. For example, our toilet need, our food need, our water needs, etc. But otherwise, you cannot apply this equity. For example, in your entrance exam, suppose they are giving 10 marks moderation. That means all of them should be given 10 marks. Equality. It should not be equity. Equity means the candidate who has got lower mark will be given higher moderation. Who have already scored higher marks will be given lower moderation. That is injustice. Now one clinical scenario that I can tell you is suppose very important VIP patient with skin wound is waiting for treatment and a snake bite patient comes. Now in spite of this VIP patient waiting for a long time, we have to take care of the snake bite patient then and there, because otherwise they may die. So that is the so-called equity applies there. Right now we will go back to the first one, that is autonomy, because that is the most important thing, and that needs a little bit of expansion. See, this autonomy, as far as the disease is concerned, the patient doesn't know anything. So we have to first of all empower the patient, the nature of the disease, what investigations will be needed, what are the options of alternate investigations, what are the treatment options, what is the cost involved, and so on. If it is an investigation, say for example a pneumonia, you need an X-ray chest. So you can tell them, we need an X-ray chest, we will take an X-ray, and there is a very small chance, like 1 in 100 chance, that things are not very clear with the X-ray, so we may have to go for CT scan. So that is the counseling, and they will choose X-ray and will take X-ray. But suppose they choose, say, I do not want to spend time with X-ray, reading the X-ray, then go for the CT. I want straight away to go to CT. We will counsel them that CT has got side effects like it gives you more radiation. Radiation basically is not a very good thing for human beings. But still, if they decide that they want CT, we have to go for CT, because what we told them is the beneficence part of it. What is the benefit of going for X-ray first? When there is a difference between opinions based on beneficence and autonomy, autonomy takes priority. If the patient has decided that they want CT, we have to go for that. Another important thing in case of autonomy is veracity. Veracity means telling the truth. So you have to tell the truth about the disease or investigation or whatever it is. Suppose it is a coronary artery disease. You tell about the disease, investigations needed, treatment options. Suppose you do not treat, then what happens? For example, the current standard of care is angioplasty. So if we are not willing for angioplasty, then we will give you drugs. The problem is when you walk upstairs and all, you will have chest pain, you will have to rest, you will have to take a tablet to get rid of chest pain and so on. Then they will decide what to do. And in addition, one more thing that we will have to tell is what is our result, the result of our hospital. So we have done, say, 1,000 cases, we have a failure of just 2 or failure of 3, complication of 2, like that. So that they have the freedom to possibly go to another hospital instead of our hospital. Now, veracity is important because telling lies damages doctor-patient relation, one, and truth, of course, truth about the disease the patient is suffering from, that is hurting. But in the long run, they'll get over it. So truth hurts for some time, but lying means it hurts for almost a lifetime. And in fact, the patient has got the right to know what she or he is suffering from and what are the options, because he or she has got to take a decision. Counseling should be non-directive, which means when you counsel, you must not counsel in such a way that patient will take a decision that you already have in your mind. For example, I'll tell an example in Malayalam. Suppose you have to do LP, lumbar puncture of the patient, and you have to get a consent. So suppose you tell the patient, നിങ്ങളെ ചരിച്ചു കിടത്തി ഒടിച്ചു മടക്കി നട്ടെല്ല് തുരന്ന് ഒരു ദ്രാവകം പുറത്തോട്ട് എടുക്കും പരിശോധനയ്ക്കായിട്ട്. ഇങ്ങനെ പറഞ്ഞു കഴിഞ്ഞാൽ പേഷ്യൻ്റ് എപ്പോൾ അവിടെ നിന്ന് ഓടിക്കളഞ്ഞു എന്ന് നോക്കിയാൽ മതി. സോ actually you do not want to do the LP, and hence you are counseling this way. So that should not happen. You give the truth and let the patient decide. Actually, it is important not just in medical field, to the public also it is very important. That is empowering ourselves to take a decision. For example, political parties or religions, what do? They do not give the facts and then give us the chance to choose. See, we are all born without a religion, without a political party, right? You have the right to have the freedom to make your own decision. So a religion should tell us these are the good things about it, these are the bad things about it. And then you analyze it with your brain and then you take a decision. So unfortunately, that sort of thinking process, we the very lazy people, we are not really ready to think that way. And they are not ready to give us the facts also. So this combination makes all the problems of society today. So the similar problems will arise in medical field if we are not giving the information and allowing the patient to take his or her own decision. And the patient is no different from we people, right? So we are not really ready to spend our time thinking and taking a decision. We just gulp whatever the political party tells us, whatever the religion tells us. Similarly, the patient also will do the same thing. They will tell us, doctor, if this child were your child, what you would have done, please do that for this child. That is a trap. Never fall into that trap. Because suppose something goes wrong, they will go around telling that this doctor asked us to do this thing and that is why we did. So let them actually take the decision. Their child and not our child. A similar thing may have happened when your parents counseled you for MBBS. They would have told you it is just 1 year of entrance coaching and then you are into a fantastic course, relaxed. No, this MBBS is going to be more taxing than your entrance. And once you pass, then you have another entrance for your post-graduation. Then you have another 3 years for post-graduation. And by that time, your friends doing some other course or some other business, they may have already started earning. Maybe they have already bought a car. So parents actually wanted you to take this course, and so that is why you are counseled that way. So the point is, we must not have a directive counseling. That's important in patient care. There are challenges in Veracity. For example, the patient is sort of incapacitated. For example, Alzheimer's disease or delirious patient. The veracity or the truth telling has got a problem when there is a threat to self or the other people. Like after knowing a diagnosis, a depressed person, after knowing a diagnosis may commit suicide. So there you'll have to use your common sense to decide. Always tell the truth. You sometimes withhold the truth, but you do not say lie. Okay. In autonomy, 3 C's are important. One is capacity. The patient must have understood the information that we have given, must have the capacity to analyze it, and then communicate the decision to us. Communication, sometimes, for example, a stroke patient, not at all easy to communicate. They may not be able to talk like that. They're illegible. So even then, maybe by the movement of hand or eyes, they may be able to communicate. So some way they must be able to communicate. Then only we can be sure that he has got the capacity. And the second is the consent. The second C is the consent. Consent must be informed. It need not always be written. It can be verbal also. For example, you want to give an injection and the patient is just rolling the shirt up. That is an implied consent. Consent can be verbal, sometimes just implied, but in major procedures it should be written. Regarding consent, you must have the capacity to give the consent. That is the first thing. Second thing is, it should be an informed consent. That means all the details of the disease, treatment, investigation, all are given to the patient, and then the patient is taking giving an informed consent. And third is, it should be voluntary. It should not be because of somebody forcing. The third C is confidentiality, extremely important. We will not make the information given by the patient to public. Even if the patient has died, even then we are not supposed to give the information to the public. Sometimes you will have to share the information with your seniors, your teachers for making a decision, but then these teachers and seniors are bound by the same law. They are not supposed to disclose it. And we are not supposed to disclose it even to the spouse. But this can be broken in a few situations. For example, a patient consents. You ask the patient whether I can discuss it in a scientific meeting. And if the patient consents, yes. And second is in public interest. For example, somebody in an emergency room, you think it is, they say it is, they fell down, but you feel it is a knife wound or a bullet wound. Then you naturally will call the police. And another example would be a drug-resistant tuberculosis. And the patient doesn't want it to be communicated to anybody. But the point is, if he is not treating, suppose he agrees to treat, it's fine. Suppose he doesn't agree to treat and doesn't agree for the information to be made public, then it is a danger to the public, because an untreatable disease is going to spread in the society. Now coming back to our beneficence, one thing, unintended consequences is acceptable. For example, you have taken the mother to the operation theatre to stop postpartum bleeding. It is not stopping, and ultimately you had to remove the uterus to save the life. So here the intention was beneficence. Hence, what you have done will be acceptable if you are taken to the court. You gave a drug with the good intention of curing the disease, but they developed a complication, say for example Stevens-Jones syndrome, serious complication. In that case, you still are protected because you have done with an intention of beneficence. So I think I have tried to explain the 4 pillars of ethics and 3 C's that are important in autonomy, and a couple of examples. So thank you very much for your patient listen.